Reason number 7 why you should not become a doctor. Medicine, the business of medicine, is under attack by private equity. You have this Wall Street investment firms and hedge funds who are sitting on billions and billions of dollars, and they do not know what to do with it. And they have this brilliant idea to basically buy up medical groups. If your practice of medicine is subject to shift work, you are under attack. And it has already happened. They have bought off a lot of emergency groups, anesthesia groups, hospital groups. And I think so far the only group that is still immune to private equity would be the surgical specialties. Okay. And so their idea basically is they buy up any independent physician groups, pay a huge settlement to the original founding members, and then from there on, they control this group and this geographical area. And they make any current physicians who stay on in their group to sign these non-disclosures and to sign a non-compete, which means that you cannot practice in an alternative company within this geographical area for 2 years. And so they force you to move out of your home and your location. But going back to the private equity's investment basically have a timeline of 5 to 7 years. They buy up a group, and after that, you as a physician are an employee. You are no longer owners of your own practice. They will set your rates and they'll do the collections for you. And they will increase the rates that they demand for insurance companies for the same level of service you were providing before. However, that increase, that delta, goes to the private equity group. Furthermore, they will take permanently a certain percent of your income. It could be 10%, it could be 20%, it could be 25%. Any new incoming residents come in at a lower pay level than they would have had if private equity was not involved. Okay, so this means for an individual physicians right now entering medicine, the return on your investment has been decreased by the entrance of private equity into the practice of medicine. And this is not only affecting you as a physician, it also affects hospital, because the private equity basically goes to a hospital administrator and they tell the hospital administrator, listen, we can make you more money. You give us a contract. Okay. But this is all like a magician's trick, because in a few years, everything returns back to the same and the hospital is unsatisfied with the service that the private equity is giving because they're not in it for patient care. They do not care about patients' interests. They only care about profits.